Hello, this is Aaron Shoemaker again, and I'm here with Dr. James Hermiller to talk to us about the Valve Symposium that's coming up. First, we'd like to know a little bit about you and about what your practice is. It's always great to put a face with the person we refer to or is treating our patients.
Yeah, well, thanks, Aaron. This is great. We're very excited about this Valve Symposium. The valve world has just exploded, and that's part due to the increasing prevalence of valve disease in the elderly, and people are living longer, and they're living long enough to have valve problems. And I think the other component to this symposium is that we have all kinds of new techniques to take care of these patients, and I think, at least for my practice, probably 80% of it these days is somehow related to structural heart disease. And it really integrates the whole cardiovascular team: surgery, interventional cardiology, clinical cardiology, advanced imaging. So it's just a great melting pot of really all of cardiovascular medicine, and this symposium really is directed at that group of patients.
Great. So what exactly does the day look like? Who speaks and how long is it? What can we expect?
Yeah, so this is an annual event, and first of all, we have two great visiting professors that come in every year, one from the cardiology side, the other from the surgery side, because this is really aimed at both surgery as well as sort of the medical community as well. So we've got Gaurav Alawadi, who's head of surgery, cardiovascular surgery at University of Virginia. And then we have Adam Greenbaum from Henry Ford, and he's sort of like right at the forefront and edge of interventional structural heart. And so the day is really going to start with TAVR, and we're going to talk about aortic valve disease. Then we're going to talk about mitral valve disease with tricuspid disease. And then this year, we're going to really also dig into advanced heart failure, because there's so many new options with these just heart failure patients, and often there's this intersection of heart failure and valvular disease, and so got a great lineup, I think.
Great. Well, who can go to the symposium?
Yeah, I think this symposium is directed not only at physicians, and that's both surgical as well as cardiac, including internal medicine and primary care, but also nurse practitioners, nursing, and those programs that are beginning to get a structural program in place. They can learn how to put that clinic together to move forward, to really grow their program.
Great. What would be one or two things that the average provider out there might not know or might see as a clinical pearl that we could learn about at this symposium?
Yeah, I think first of all, understand that there's really innumerable new, less invasive ways to take care of valvular heart patients. Many patients with aortic stenosis, who are 85 to 90 year old, just a few years ago had no options. And now today, with the therapies we have, they come in, get a valve replacement, go home the next day. So I think one, to be sort of cognizant of what's going on out there with these less invasive techniques. And then I think two, how do you work up these patients? How do you sort of evaluate them? And then who is it that needs to get pushed on to sort of more advanced intervention therapies?
Fantastic. I know every time I attend an event like that or talk with you guys, there's something new that I did not know about. So it's really exciting to be able to be informed about that.
I mean, we're all sort of focused on aortic valve and TAVR, but we've moved on now to mitral valve disease, tricuspid disease, and that's not to mention, I think, some of the exciting information that's going to be presented about heart failure and advanced heart failure therapy. So it should be, I think, a great day, really worthwhile attending.
Fantastic. Thank you, Dr. Hermiller. So the date is May 13th at the JW Marriott. This is a free event for all of our providers, and it's 5.25 hours of CME or CNE for all of our providers. So please consider having yourself or one of your practice partners attending this great event put on by one of the world's best cardiology groups. Thank you.